of immersive in healthcare and kind of talk to you about different definitions that we use. And then you guys are going to get a hands-on demo with some of the suites that we talked about. So just for disclosure, I mentioned at the beginning of this course I have a lot of different hats. Some of them have commercial interests, so this lecture is pretty much all commercial interests. So I'm going to tell you about my work as the VP of Immersive Medicine with Luxonic Technologies. So let's get to it. Hopefully we'll kind of spend no more than 35 minutes on the lecture portion, leaving us close to an hour. Or just under an hour or two for you guys to play around. And it'll kind of actually work out 2 people to a headset. We have a relatively small class size today, so that actually will give you guys more time. Typically we have 3 headsets going, but one of the websites that we load on the 3rd one I noticed was down this morning and wouldn't be back up in time for this, so no worries. So we'll go to slideshow view. Okay, so we're not going to talk about any of the extreme medicine stuff yet. But basically, Luxonic Technologies is a Canadian company headquartered in Saskatoon that leverages immersive technologies to deliver healthcare for diagnostic imaging, certification, education, and training. So, what does that mean? When we think about immersive technologies, we think about putting us in an alternate world. So here we're talking about putting ourselves making ourselves physically present in a digital world. But oftentimes when we're describing this to investors, to external audiences, we like to use the book as the example of the very first immersive technology, because if any of you were avid readers when growing up, you know the power of getting lost in a good book. So immersive technologies will cover everything that we talk about, but let's get into kind of examples and specific definitions. So virtual reality, everyone here's heard the term before, yeah? So that means fully immersing ourselves into a digital world where we don't have any interaction with our physical world. We are lost and we don't have that situational awareness. Versus augmented reality. Who here's heard the term augmented reality? So who here's heard the term mixed reality? And who here is aware that there's a difference between the two? So oftentimes they're used interchangeably, but truly augmented reality is when you give yourself a digital overlay in the real world. So the example is here looking at the anatomy models. You still have presence, awareness of where you are in the room, but you also have a digital overlay. But it doesn't necessarily allow you to interact with it or add anything to your physical world, whereas mixed reality is a hybrid of that augmented reality overlay that you can also use to help gauge your physical world. So an example would be using augmented overlay to measure or map out during surgical planning. So that's the difference, but you're not going to be quizzed on it. It's just kind of more of a nuanced point to say that there is a difference, but honestly, don't worry about it. Okay, so the final technology we're going to discuss is 360 video. So this is when you put yourself into a type of world that was filmed with a 360 camera. So when you wear a 360 headset, or you can see on your phone, you have a 360 view of the world around you. So let's talk about where this comes into play into medical education. So we're seeing this more and more over the past decade. We've seen this in grand rounds, even in Canada. So this is an example from the University of Manitoba, where the pediatric grand rounds as early as 5 years ago was augmented in virtual reality in medical education. In the States, we're seeing megalithic partnerships between Case Western Reserve, Cleveland Clinic, Microsoft HoloLens, collaborating with medical schools for anatomy teaching and using both augmented reality and mixed reality to teach medical students. Here's a professor of surgery in the UK who talked about immersive technology for teaching surgical rounds for his medical students and employing that as an educational tool in the classroom. So what does the evidence say about the use of augmented and mixed reality technologies? So here's a study using HoloLens for memory recall in anatomy and physiology. And interestingly enough, it may just be the way that we're trained to memorize information. These scores were still better for those who were the group so there were 2 groups. One that was tested after memorizing traditional PowerPoint for brain anatomy, and then one that was taught using the HoloLens for brain anatomy. So the scores were higher in the traditional group, but learner confidence and test-taking anatomy and anxiety were decreased in the HoloLens group. So probably suggesting that there's a role for both when it comes to learning as well as applying knowledge with confidence. What happened here? Oh yeah, here's a video of the Microsoft HoloLens Anatomy module at play. So we'll see if this plays for me. Yes? Okay, great. I think usually there's sound here. No, not today. That's it. So this is kind of just an example of what I was telling you about with the partnership between HoloLens and Case Western Reserve and Microsoft, and using the augmented reality as well as mixed reality to teach medical students anatomy. So you can see that they're able to peel back layers, and they can go from looking at the outside of a human to looking at the musculoskeletal system to looking at the vascular pathways. So really good way of visualizing anatomy. And then you can see other ways in which there's digital and overlays of the real bones. So we don't have to watch the whole thing. Okay, so here's kind of some of the stats that we found from a Luxonic perspective on why the virtual reality has benefits for education, training, as well as learning. So it results when compared to traditional e-learning, so that's the standard that it was compared to, what these stats refer to, 4 times faster learning in the classroom, greater learner confidence, so that was also supported by the Microsoft study that we just went over, better emotional attachment to the classroom content. So if you're looking at an anatomy model on a textbook page versus if you are seeing an anatomy model in a digital overlay, which one do you think you're going to have more of an emotional connection to? Better retention at 4 months after learning, more focused, as well as cost savings, which matters more on the administrative side. Okay. So we're going to see several summary slides throughout this presentation on the benefit of immersive. So here's one of the examples. So you can get infinite repeats, so it's safe, repeatable, standardized, so you're able to practice high-risk procedures. So the first time you ever do a central line, for example, the first time you ever do an arterial line can be before you ever touch a patient. You can practice very outside edge cases that you may see once in your training. And see those create procedures for that in the digital world. And like we said, better retention, learning outcomes, and lower operational costs. Okay. So I kind of went over this at the beginning, but what we are doing with Luxonic is spans across digital, diagnostic imaging, medical education, professional training, and healthcare delivery. So the next set of slides is dedicated to case studies of some of the modules that we're testing out today. So unfortunately, our Medcast 360 site is currently down. But this is an example of 360 video applied for medical education and training. So what we did was we partnered with Sask Poly in Saskatchewan and with their School of Nursing. So for OR nurses learning their role as either a scrub nurse or a circulating nurse, they would be orientated as to the 360 video the 360 environment before ever setting foot into an OR. So when you watch the video, you're actually, here it's 2D, but when you put on a headset, if you look up, you can see the ceiling. If you look down, you can see the floor. You can have the ability to look around you. You're immersed in the OR. You can hear the sounds all around you. And you're viewing it as if you're training from the point of view of a circulating nurse. So you would see kind of where you're supposed to be and have that familiarization before you ever got into the OR. So here's a laparoscopic cholecystectomy, or just a non-invasive way or minimally invasive way of taking out a gallbladder. So that's one example of a case study. We've also used it for telerobotic ultrasound training, so to help healthcare workers with minimal experience using a telerobotic ultrasound machine, using it to supplement their in-person training, to be able to capture ultrasound images. And one of my favorite examples, so when we have to send pediatric patients for MRIs, as you can imagine, it's not always easy to get kids to stand still, sit still for the length of an MRI, and oftentimes they may have claustrophobia, they may have a lot of anxiety. So oftentimes we just have to sedate the pediatric patients. What we did in this study is we orientated the pediatric patients to the MRI environment in 360 video, and then introduced them to the MRI environment. And in 83% of cases, we were able to get rid of the need for sedation because they had that familiarization, which is really important and promising. Okay, so the next thing we're going to talk about is our Luxonic imaging platform. So typically, if you're a radiologist, to be able to read images, you need a significant amount of space along with your high-resolution monitors and a secure workflow that has all of the tools you need to manipulate your image, to mark it up, to measure things, to put arrows, to change the contrast, to flip it around, etc. So if you're in an environment that doesn't support that amount of space, for example, a rural emergency room, you don't necessarily, previously weren't able to support that workflow. So what we did was we digitized this entire workflow and put it in the virtual reality world, and we now have Health Canada approval with FDA approval pending. So we like to joke that if you're a radiologist, you can read your images from the beach. So this is, you're using it for education, collaboration, as well as clinical applications. So for example, if I'm a rural emergency physician and not quite sure about the post-imaging of a bone that I've just set, and I want to make sure that the angulation's properly set, or whether it needs a re-reduction, I can collaborate with a remote expert and we can go over the imaging together. So here's a video. Here's a video of what it looks like. And you'll be getting to experience this on one of the headsets. Let's see if it'll play. In theory, there we go. I'm not sure what's happening with the volume today, but that's okay. It's just kind of generic background music. But this is what you'll see when you put on the headset, and we also have collaborative capabilities. So if we're in that mode and there's two of you in a headset, you can kind of, one person's the leader, one person's a follower, you can say, hey, these are the findings. On a CT image, you can kind of scroll through the images the same way you would scroll through a typical CT. You can view multiple images at once, you can mark them up. So it is just really miniaturizing and your workflow and making it more portable. So this imaging platform is currently commercially available for clinical use, educational use, for even collaborative interdisciplinary use. Okay. Previously told you about some of the extreme environment work I do. I previously talked to you about the aquanaut missions I've done. So I've done 2 to date. So that was the Neptune missions, nautical experiments in physiology, technology, underwater exploration. So my entry into Luxonic was actually when I was the crew medical officer on this underwater mission, and we brought the CVERT, or the Luxonic imaging platform, with us underwater. And basically what we did in a demonstration of its operation capabilities is I loaded up the imaging of a simulated trauma patient with a scapular fracture or a shoulder blade complex fracture. And then I was able to link up with the head of radiology in Saskatoon, Canada, over 4,000 kilometers away, and we were able to review that imaging together, and I was able to get guidance on how to manage it as a crew medical officer. So you can also see that we had loaded up the image here on the desktop, so you don't necessarily need virtual reality, but my colleague was able to meet me in that virtual space. We've also tested this in parabolic flight. So I've talked to you a little bit about a parabolic flight, the LABMP comet going up and down. So here's my colleague Heidi testing that same sweep in microgravity. She's having a blast. Okay, so then depending on time, it's going to be a little bit difficult because unfortunately I don't have this loaded up on a third headset. So if we have time, we'll switch over from the imaging platform to caregiver. So this is kind of where that idea of training, education, practicing high-risk scenarios before you ever lay hands on a patient, retiring risk comes in. So this was, again, one of my entry points into the company. So as you know, I do a lot of space stuff. So the company received a funding grant from the Canadian Space Agency to create medical procedures in virtual reality to help astronauts on long-duration space flights keep up their medical skills. So we may have talked about this in the space medicine lecture. If you're a crew medical officer, you're not necessarily a physician. You used to have 40 to 60 hours of medical training, and now with the astronaut training curriculum as big as it is, you have about 50 to 20 hours. So it's easy to imagine if you learn to put an IV in on Earth, and then you don't have to practice that skill until 9 months later when you arrive on Mars, you may very well de-skill, and by the time you're done sticking your patient there, it may have been 14 hopes. And I was kind of using that anecdote to talk to a retired NASA astronaut, and he laughed and said that was exactly the case that happened when he was up on the International Space Station, is he lost his ability to maintain his skills. So, some case studies. So we've used this for partners in Germany for anesthesiology assessment. We've created, partnered with the Saskatchewan College of Paramedics. So they use multiple of our modules now to actually certify their paramedics as professionals. So we have airway modules, which if we have enough time, we'll load up. We have cardiac modules, we have infectious modules. So it's everything. You basically are a paramedic on scene. You see a guy who's looking a little rough in a back alley, and then it's up to you to go to do everything from the scene survey to the simple maneuvers that you might do if you've done basic first aid, kind of that head tilt, chin lift, all the way to a paramedic skill set of intubation. So hopefully you'll get to practice that. We've also done partnerships and work for the Saskatchewan Society of Medical Lab Technicians. So again, familiarizing students to the lab environment before they ever get to the lab, which is kind of cool because the fidelity of this is quite high. So you have to do everything from donning and doing your hand hygiene, donning your gloves, and then pipetting. In this case, it's a urine sample from a urinalysis. And what's really cool is when you put that slide under the microscope and you look through the field, you actually see what you would see in a microscope. And like I said, we've also done work for deep space missions, so I'll show you what that looks like in a few slides. Let's go through the paramedics module to give you a sense of what this looks like. Play. There we go. So that's an example of the head tilt chin lift. And then this is kind of the training and assessment module, so they tell you, how long they want you to do a maneuver for, where they want your hand placement to be, and then if that doesn't work, you're going to the next step, which is either a nasopharyngeal airway or an OPA, an oropharyngeal airway. So then you would go through the measuring your device, and in this case, they're putting in a nasal trumpet. So you're lubricating it, finding the right size, and then using that to help the patient breathe. And so then you kind of escalate, and if you watch this through, I think you eventually go towards intubation. So in this case, you're finding a guy who's down. Sorry, it's a bit gross. There's some vomit there. Finding guys passed out in an alley, not quite protecting his airway. So now you're going to suction him, and then you're going to make sure you have all the equipment and set up for an intubation. So you won't have time to go through the entire module, but we'll set it up. You'll start off in the back of an ambulance, and then it's kind of up to you to interact with your environment. So we won't spend too much time on that. Okay, so just a refresher from last time, space is trying to kill you. So talking about applications for virtual reality and immersive technologies in space. So why does this matter? So here's a snapshot of NASA's Human Research Roadmap and some of the risks, and you'll notice that the risk of inadequate human-computer interaction, as well as the risk of skills deterioration, as we just talked about, is very much on that list. And so we also have to consider the packing conditions for space. So we talked about the backpacking principle, or the Aladdin principle. So infinite cosmic power to get to space, itty-bitty living space. Meaning that our support tools have to be low cost, low volume, low mass, easy to use, low training, low astronaut time, and also have to be resilient to the zero-G high radiation environment. So VR does meet those criteria. And so this slide is up here just to kind of suggest that, it would be really nice if we had am I dating myself if I mention the Matrix? Has everyone here seen the Matrix? Okay, good. I mentioned it to one of the students I teach once, and they said that was before they were born. So, so there's a scene in the Matrix where Neo is uploading all of these skills to his brain, which would be really nice. Like, it would be really nice to sign up for technology in the future of medicine, and then just kind of plug something into your brain and boom, you have the entire curriculum. But that's not where we're at yet. But this is kind of an intermediary step, because you are still kind of building those skills in a virtual world and then bringing them back to the physical world. So this is kind of a vision for how immersive technologies are used in spaceflight. So we talked about the value of analogs and test beds for preparing us for spaceflight. So we talked about the NASA Extreme Environment Mission Operations underwater research habitat at the Aquarius Reef Base. So this is one of the early missions, and this is one of the crew members using a augmented reality, and he, I think on that same mission, was also able to do telesurgery and remotely guided surgery. So it's, that's an example of, I think, this might actually be the neutral buoyancy lab. But it has been used on station, not for medical applications, but for just-in-time training, for operations, for emergency protocols. So you slip on an augmented reality device and your checklist appears in front of you. So as you can see, rather than having the standard of care, which is pages and pages of paper procedures, memorizing all of that, having that at your ability to pull it up instantaneously. So kind of bridging the gaps between applications for healthcare versus what we can do for spaceflight. Here's an example of a module that we built for the Canadian Space Agency. Here's what this looks like. So in this kind of opening scenario, this is kind of like a video. This isn't something that you would actually take part in, but it's, an EVA has gone wrong, the moonwalk has gone wrong, your rover has flipped over, you notice that your EVA buddy is down, not responding, you're kind of moonwalking over to them. You suddenly see that there is evidence of a suit breach and that there is a decompression event, okay? And if the audio were working, you would hear a very familiar voice because it's mine doing the voiceover in this video. And then you're calling upon your emergency protocol to breach the suit. And then where the VR component comes into play is in this next scene. So you've managed to return to base. You can see your augmented reality heads-up display telling you to return to base. And so then, in about 2 seconds, you'll be in the medical bay. And so then you'll be seeing your EVA buddy who needs a head-to-toe assessment. And what's really cool is you can actually perform that head-to-toe assessment. Like the first time I was testing this out and I was using the stethoscope and I was putting it on the patient, I realized that I was actually treating this as if it was a real patient, and I had this moment where it's like, oh my gosh, I'm totally in the moment. So you can do your vital signs and your get the biometrics of your patient. And then one thing that's really cool, we'll hang out here for a second, is if you want to do something more involved, like a ear examination and look in the otoscope, hopefully we'll pick that up next. Notice the pen light. So you can actually shine the light in the pupils, get a pupillary response. See it in straight there. Yeah, you do. So hold on for one more second here, and then we'll see what the ear exam looks like because it's actually kind of cool. Perfect. So grab the otoscope, and then when you look in the ear, you actually have a close-up view of the tympanic membrane, and like a pristine one here, but you can also have diseased ones as well. So I find that super cool. So again, we don't need to watch the entire thing. And then I just go back to Safari, yes. Oh, here we are. So like I said, we've done this for the Canadian Space Agency, we've done this with regulatory bodies that certify professionals, we've done it for education, so there's multiple applications for this. Let's go up to the slideshow. And to the module, okay. So remember in our space medicine lecture, we talked about using technology not just to meet the same standard of care as we have here on Earth, but augmenting that and saying, well, how can we make medicine even better? So we also like to ask that with immersive technologies, because we kind of alluded to some of the superpowers of immersive tech. So here is a slide that we borrowed from Oculus, but here to go more into depth. So we talked about building that muscle memory, retiring risk, having unlimited redos, seeing edge cases, cost savings, better user retention and confidence, next level engagement, so leveling up when you reach one level of competency, impossible scenarios, so those cases you'll see like once in a career. You can get insights onto how you performed. You can look at various perspectives. So we've actually created a ATLS, or Advanced Trauma and Life Support, trauma scenario for NRC and IRAP. And basically you can do it from the point of view of running it as a trauma team leader and a physician. You can do it from the point of view as a nurse. So there are collaborative abilities as well. Yeah, so that's kind of a good summary. Okay, so here is the last module I'm going to tell you about. So this is a mixed reality point of care ultrasound device. So ultrasound is kind of the workhorse of the emergency department, particularly for rural emergency medicine, where all I have is an X-ray machine and a bedside ultrasound. So if I need to get a CT or MRI, they need to go to a bigger center like the city. So typically your bedside ultrasound will be 400 pounds, will be large, it won't be very mobile. Or you'll have a handheld ultrasound like the Butterfly IQ with a smaller display. So the Canadian Space Agency, in partnership with Impact Canada, started a competition called the Deep Space Healthcare Challenge that was designed to leverage healthcare innovation in emerging areas, including virtual reality, to address key challenges in health, including trauma, women's health, and there were 6 kind of topic areas, that with the idea that it would both help rural and remote, as well as deep space healthcare. So we came up with the idea of saying, well, what if we could make your display better, more portable, and more ergonomic by having a mixed reality point of care ultrasound exam. So this is what we came up with. So my screen is actually floating in front of me, and then we also managed to test this in microgravity. So you can see me, this was last month at the National Research Council in Ottawa, so you can see me floating there and testing this on my teammate Kelly. And so the ergonomics end up being way better. So if you're ever scanned a patient, typically you're scanning them and looking to the side, your screen's kind of filling up your whole field of view, and you can make it a lot bigger. And you'll actually experience this yourself. Don't worry if you don't know how to scan, we'll take you through it. Okay. So this is a familiar slide because we talked about what the International Space Station has in common with a polar medical deployment, a remote village, or an underwater research base. And who remembers the answer? They're all examples of remote, resource-limited areas. So the thinking is that maybe we can use the best of what we do in space health and innovation to help our most rural areas. And as of the 2019 census, 44% of the world's population lived in rural areas. So again, that same scenario I described to you, away from the bells and whistles of a tertiary care hospital, no necessary access to ultrasound around the clock or CT scans. So here's some of the other Earth-based testing we've done. So we had a second Aquanaut mission last year, so we deployed the mixed reality point of care ultrasound on that underwater mission. Here's the Arctic Circle testing we did just outside Svalbard last year. And then this was when we were demoing this for the Canadian Space Agency, so you can see astronaut David Senja testing this point of care ultrasound device. And so this kind of, to kind of really hammer home the use cases of this, aside from remote and rural. So this is kind of just talking about bringing the best of what we do in healthcare innovation to our most in-need areas on Earth. So I was on a medical deployment to Ukraine shortly after the war broke out, and our, I think I mentioned this a few classes ago, like our clinic was essentially a shipping container, so we didn't have much at all. One of the other physicians had his handheld ultrasound. So innovations like this can help bring the standard of care to places on Earth where we're not typically able to meet it. Okay, so just to close this part out, where are we headed? So we haven't talked about this yet, but because this is a technology in the future of medicine course, I want you to start thinking about not just technologies in silos, but where technologies intersect. So what's the big technology that we haven't really talked about this class that's on everyone's lips this, last year, this year? AI. AI, yes. Okay. So what about the intersection of different technologies, AI, big data, and, for example, virtual reality and imaging? So already, this is from 4 years ago, grand rounds at McMaster University, talking about how AI can impact medical education and what we know, okay? This is from the College of Family Physicians shortly after the pandemic broke out, and talking about how the impacts of AI on family doctors. And so when we talk about our imaging platform, talking about how we can integrate AI to look for gaze tracking and figure out where the radiologist's attention is, looking for error tracking, those are potential applications. So where do we go from here? We kind of talked about this already, is being able to kind of have instant access to just-in-time training, or just being able to augment our skills as physicians. So we are fully trained to deal with emergencies. We have to go through things like advanced cardiac life support training every 2 years just to make sure, you know, we can run a code if someone comes in with their heart stopped. However, there is a lot going on in a code situation. You as the trauma team leader are the one who is kind of air traffic control. You're telling, okay, you need to do these compressions, you need to do them for 2 minutes, you need to do them with adequate quality, but you need to make sure that there's a lineup of people to take over. You need to make sure which meds are given. You need to make sure you know what rhythm you're in, how your patient's doing, when you're going to check on them. There's a lot going on. So humans are fallible. So having the ability to use something like augmented reality or mixed reality to create a digital overlay and be able to guide your thinking in a crisis scenario when there's a lot of stress going on will make us better. And I had a very real example, which is more low fidelity. We had a code going on, middle of nowhere, many hours from here. This was about 4 years ago, 3 years ago now. And it was in the middle of the code, and there was just so much going on. And I said, okay, drop this dose of this medication. And then, because we know that humans are fallible, there's giant posters on the walls of the trauma bay. And I just remember staring at that in 1 second. I said, no, wait, that's wrong, don't do that. This is a dose. So you're still kind of taking yourself out of the trauma situation because you're kind of pausing to look at what's on the wall, because you always want to double, triple check yourself, do no harm for the patient. But just having that within your environment at easy recall is the next evolution of that double check for physicians. Okay. So that's all I got. We talked about a lot here today. So here's a summary slide of just kind of talking about I think we've talked about a lot already, about the benefits of immersive technologies, the accessibility, cost savings, effects on learning, retiring risk. Okay. So just to kind of summarize, there's a lot of applications for resource-limited areas in space on Earth, and the next steps is, you know, making these more accessible, launching pilots, getting feedback, and contextualizing towards use. So I'll take some questions from you, and other than that, we can skip to our workshop. Questions, comments, concerns? Yes?
I know you mentioned, like, for example, having like that frame of reference for some like important information, right?
Yeah.
Like that's for medicine, right? So let's say for other fields, how do we like create those frames of reference for ourselves?
Yeah.
So, like also like what do we know like that we will need in those kind of scenarios, in those like extreme like emergency scenarios, right?
Yeah, so this is an example. I think this comes from HoloLens, and so I don't think this is a video, but it's just basically there was an issue with something mechanical that needed to be fixed. And so basically they initiated a real-time call with a remote expert who could both see the same view that the user had and then also create a digital overlay to tell them how they wanted them to work. So this is a non-medical example. This is something mechanical, I forget the context, but it was called Dynamics 365 Remote Assist. So that, you know, even in engineering and mechanics, in aerospace engineering, in the car shop, there's also applications for this. Yeah, any other questions? Okay, all right, so take a minute, and then what I'm gonna do is I'm gonna set up different, how much time do we have? We have about 40 minutes, which is good. So I'll get two of you, we'll maybe use this table and that table, and then basically you guys can spend about 20 minutes as a group of two, so make sure everyone has a chance to get on this. Use the software. So this one will be the point-of-care ultrasound. So I'm just going to quickly set it up. Does not accommodate big hair, just FYI. Okay. My ask is that you please don't drop the transducers. They don't like that. Okay. So it's fairly easy to use. If you're left or right-handed, we have controllers for both. Okay. So I'm going to launch the software so you don't have to worry about that. I'm just gonna make the display bigger. Okay. And then basically, and I'll put in a scan. Okay, great. And so then I'll help you out. So basically I'll come around because does anyone here have any ultrasound experience? No, okay. So you ever shaking your heads. I can see you, by the way. Okay, so then basically what you're gonna do is you're gonna find your radial pulse and then you're gonna put goo down. I'll need that goo. And so when you're, yeah, that's the one. Okay, thank you very much. Okay, and then if you're noticing that the display is blurry, it's always a fit issue. There's a dial here at the back, so you're just going to adjust it till everything's clear. That has always historically helped to fix things. Okay, then you're going to put goo on your partner's wrist over where you feel the pulse. Okay, and then you're going to look for something small and pulsatile. Okay, and then if you want to get fancy, you can also adjust the depth. I'm going to start it pretty superficial at about 1 centimeter. Because your radial artery tends to be pretty superficial. So you're looking for something round and pulsy. Okay, and if it matches your pulse rate, you found it. Okay, so we'll get you guys up here. And
You want to try first?
whatever you want to do. I'm just going to quickly wipe this off so it makes it ready. Okay. And then once you're done, you can wipe the glue off like this. Okay. And then I'll bring this over to you guys. I'll give you the second. You guys. So this one will be the Sievert Imaging Suite. So I technically downloaded this before we started, but sometimes it just erases if it logs out. So let me just see where we're at. And it also thinks I'm outside my zone. Okay, so we're going to just push the floor boundary down. There we go. So you can create both stationary or mobile boundaries. And what I think I'll do is I think I'm going to create a big boundary so you guys have room to wander.
I think I should be fine here.
Undo. So you have like this whole area. Okay, so I'll confirm that. Okay, and if you wander outside the boundary, it goes into pass-through so I can see you all of a sudden. Okay. Oh wow, it really doesn't like that. Okay.
They're not moving?
I hope they're moving. So, interestingly, it's put me on the other side of the screen. I'm just going to see if that's the table. Okay, so
I did see,
I'm going to exit
like,
as
I think it's muscle,
exit.
but I don't see pulse.
Exit to lobby. So, I'm going to come here and see.
Oh, yeah, I see.
There we go. So, I have more time, there's probably a way to move this, but. So what we're going to do is I'm going to exit here. I'm going to bring this, where do you guys want to work? Do you want to work on this side, on this side?
You want this one?
Okay, sure. So then we'll do this. Okay. Go into Sievert. And so your trigger finger is your workhorse on both the headsets. There are two different headsets, and I'll explain the difference once we all get going here. Okay. Log in. Development.
I don't see pulse, but I do see it.
So what I'm going to do is I'm going to load up a chest x-ray for you. So you don't have to worry about loading up a case, although if you get to the point where you're comfortable enough with it, feel free to browse. So under medical education, we have a whole library of tons of different cases, tons of different sources. But chest x-ray is really the easiest and quickest to download. So we're going to download 2 chest x-rays. I'm going to go to
Looks good.
I'm going to load one, as soon as it's ready. Okay. only time they'll use the bottom trigger is when you're dragging and dropping. Okay. Okay, so step right in. Do you want to go first? Yes. Yeah, let me take that back. So basically, you're gonna that VR radiology reading room I showed you. That's kind of what you're going to be in. Okay, and then I can help you with the strap. The strap on this one's a bit different. Are you right or left-handed?
I'm right.
Okay. They give you a left-handed controller. Okay, may I adjust this for you? For sure. Okay. Sorry, put it over here. Okay. Oh, sorry. Okay, let me know how that is. And then basically, something that's going to say.
Do you like decide like ringing?
It's just like this.
Secure it, okay? And then
Yeah,
technically
that's
you can
what I
also
saw.
secure these bands,
I
but
can see
since
it.
you won't be in it too long. Okay, so do you see the radiology reading room now?
I do.
Yeah. And so there should be 2 X-ray images loaded up, usually probably a little bit off to your left. Okay. And you can see both the front on view and the side view. And then if you're a radiologist and you want to play around with the markup, with the contrast, you can do that. And then if to your left, there's another panel at the bottom. It says medical education. If you wanted to load up more images, you could do that. Yeah. Yeah, so this is virtual reality, so the only time you'll go into pass-through is if you step outside your boundary, and just be careful, right off to your right, there's a table, so don't walk into it. So if you go outside your boundary, it'll kind of go into grainy black and white, and it'll show you, yeah, you can carefully walk towards me, so do you notice how you're walking out of the, carefully about the table? Yeah, no, come up forward this way, keep walking, keep walking, keep walking. Do you see how your boundary's disappearing?
I do.
Yeah, so now you're in pass-through. So that's how it keeps you safe. And so when I was drawing the boundary, you have the opportunity or the option to create a stationary boundary, which is just kind of a circle, or a room scale boundary if you want to wander, or if you're playing really active games. I hear there's some games that are like just designed to destroy everything. So, yeah, so feel free to play around with the tools there. Your trigger finger will be kind of your word. Yeah, this is the right-handed one, so this will feel more comfy. Okay. So what you want to use the trigger finger right above it. Yeah, there's a second trigger. I'm just going to move your finger up here. There you go. Okay. How you guys doing over here?
I feel like I don't see anything.
Any palsy? Anything palsy? Okay, let's see.
I don't know if it looks like it's like a
Are you looking at next
A video.
Yes.
Oh, you know, unfortunately what it does sometimes,
I guess it's
yes, okay. So put it on. See how that snowflake is orange?
with the extra squeeze. I like there.
And if you want, you can
It is really
untighten,
neat.
loosen it, and then tighten it again.
And you wanna?
Yeah.
Oh, go for it.
So the, when you, sorry, I should have warned you guys, when you move it around too much, it decides that we're just gonna put the image in freeze it.
Okay.
So you have to take your trigger finger, and are you right-handed or left-handed? Okay, yeah, so use this controller, and then use the trigger finger to click on the orange circle, the snowflake,
That is super.
and that'll put you into live mode again.
Oh,
That's right.
okay.
So now, let me just okay. So now,
I think so.
no, I didn't warn you about that. So that's I'm gonna,
Oh, now I
Yeah.
see.
Other X-ray.
and do you know what depth it says if you look off to your left, like the bottom left? Yeah. So go ahead and take your index finger and scroll on that scrolling bar and make it like 1.5 or 1 centimeter. So now you have like a much shallower field of view,
Yeah.
and that's where my artery is.
There we
It's
go.
a very
Okay, is that good?
Yeah.
shallow point.
Thank you.
And that's that.
Do you start to see something
Yeah.
round and pulsy and wiggly?
Yeah.
Like I have a teeny
That
artery,
is so
so it may
cool.
just be a little bit
It's
pathetic.
not, I see.
Okay, so do you want to take start
Oh.
driving on the, can I feel your pulse? You do. You have a nice strong pulse. I think your artery's a bit deeper. So you may be able to visualize my own artery on that
That's
side.
funny.
Do the boundary side, like if you want.
Oh, I can like walk over.
Yeah. I like make sure you don't.
Yeah.
Okay. Yeah. Good. And then yeah.
Wait, but like this is where the wall is.
So then the other thing you can do is you
So,
can also visualize the
50 normal
transverse
chest,
view.
X-ray,
So
23
rotate the probe 90 degrees
Short
over the pulsey thing.
Diagnosis.
Yeah, there you
Normal
go.
chest
And
X-ray.
so come more over to my thumb side.
Wait, what if we changed it to?
You'll probably find right there, and over there. And you might be able to see the long tube of the artery if it's in the right place. And then that, if you kind of put an arterial line, that'll actually help you guide where to put your needle. And that's really critical for monitoring blood pressure in critically ill patients. Okay. So now that you're an expert, we're going to get you to find a radial artery that you don't know where it is. How you guys doing over there?
Pretty good.
Yeah?
Yeah.
You can see x-rays okay?
Yeah, I was trying to see, so it says like medical education.
Yeah,
book.
go to that, click on that, and then do you see, like right now it says like RNIS or something like that?
Well, when I clicked it in front of me, it says launching the medical education module, clear something.
Yeah, you can, if you clear that, it'll just get rid of the current x-rays you have,
Oh,
which
okay.
it takes like 2 seconds to download new x-rays.
I see, now I see the MIRC thing.
Yeah, so then go to the arrow on the right of it,
Mm-hmm.
that'll go to the University of Saskatchewan.
Okay, cool.
So once you see that, maybe like third row down on the left, you'll see the x-rays, the chest x-rays.
Cool.
Okay, so just click on any one of those x-rays you download.
How does the tattoo
Yeah.
through this?
You won't see it, like this is kind of good for visualizing
so
squishy tissues.
I just realized.
But the more we learn about ultrasound, like it wasn't really a thing when
Yeah, I
was
think
young,
so.
but the more
I'm
we learn
trying
about
to
it, we
get
can even
there, yeah.
diagnose
So maybe
fractures
this
with it, like
and-
you'll see a
Oh, I
step
see,
off.
yeah. Okay, so
So
the one
if
that
you
we were
increase
on
the depth on it,
was
you'll see
a
this
normal
black
chest X-ray
shadow,
of a
that's your
23-year-old
bone,
male.
because the bones don't
And so
really
now
have
we're
long
going to
heterogeneity.
normal
So
chest.
if you were to
wait,
have
I
a
want normal one. I
wrist
wanna-
fracture,
like,
you would
oh,
see a step off, and you might see
Cough,
some fluid
fever.
around it, so you could
Oh,
actually
pneumonia, okay.
diagnose a fracture with that.
54-year-old pneumonia patient. Let's see this.
So yeah, one of these years I'm going to actually figure out the casting so we can all see what everyone sees. And in fact, I might be able to cast on my phone, I'm not sure.
Oh, you can't see what I'm doing. Wait. Diagnosis.
Is it that the new?
Yeah, it's pretty cool seeing your insides.
Yeah, so I mean like a pneumonia. So it's possible pneumonia and it's a 54-year-old male.
Ooh, do you see pneumonia?
I'm trying to figure out how to get the images to like show up in front of me.
Oh,
'cause
okay,
right
so
now-
sorry, this one's a bit, so the lower trigger finger, the one that your ring finger's
Oh, I
over,
see. Cool,
you
yeah.
drag and drop.
Oh, I see.
That's the only time you'll ever use
Got
that. It
it.
is a bit silly.
Oh, that's so cool. Okay. Oh, okay. Oh, and then you can reveal the okay, so basically on the left side you can see diagnosis, and then you can like reveal it if you want to.
Yeah.
Or you can like try to figure it out yourself. That's so cool, because then you can like just practice.
Is it still the two like the front view and the side?
Yeah, front view and side view. So manipulation options, yes. Oh yeah, manipulating zoom and stuff, that's so cool. Do you wanna take a look at Do you wanna take a look at this picture?
Oh yeah, there's like a table like to your right.
On the right side? Yeah, we good. I can see like a little bit underneath, so we'll be good. So findings. So never closing the interstitial markings. There's a closing
Oh, we're not in the same map.
of the interstitial markings.
Let's start testing the different.
Oh, you gotta see this, sir. This is pretty cool. Here, I'll give you the controller first.
Sure.
Here we go. Thank you. Wanna put this on? Oh, so cool. Or do you want me to pull this forward? Yeah. Cool. And then you want me to maybe say it?
I think it's okay.
Is you okay? Yeah. And then you
Yes, okay, so now you can see, now you can kind of click on that
There you go.
group and see what
Oh,
they're
There you
seeing.
go. Perfect. You can like see everything, right? And I think it should be on the right side. Is this one?
Like the scan?
Yeah, the X-ray.
Yes.
Oh, like, you see
you
that?
may
Yeah,
want to
that's
adjust
like a
the
different one.
depth.
No, that's like
What's
the pneumonia patient. And then I think on the left side it shows like the explanation.
And is it like right at the edge, is it
Not
right at the
really.
bottom?
Oh.
Like you kind of want it near the middle of your screen. So if you want to, the other cool thing is if you want to come over here, we got the casting working. So
Oh.
now we're kind of creeping on.
Oh, that's so sick.
Yeah.
Oh, is it the
so
Yeah.
we're casting to my phone, so now we can see what you see.
We can see what you see. Yeah.
So don't do anything like try to take down the system or anything. Yeah.
That's so cool.
You sure it's not pulsing?
I don't know, maybe drag the whole way.
Yeah. The other thing I like what you're doing, because most of the
Oh,
time,
I see
you
it,
see it?
yeah. I have to
Also,
breathe.
So the nice thing is you're young and you're healthy, so you actually have a slow resting heart rate. I could feel it when I was feeling your pulse. So it's not gonna be like jumping. It's like you just finished running a race.
I'm ready to take
Yeah. So or if you like work out a lot, like you'll have a low resting heart rate. What was it? I don't remember.
Mine is 68. So
Oh, I have a high heart rate.
What's your heart rate?
Well, like, at least that's what my Apple Watch told me. I don't know how accurate it can be.
So yeah, let me see what she's saying.
cool. Oh yeah, are you trying to like switch over the cases or
I
something?
am.
Yeah. So if you go
Oh,
like.
look at this. Tell it better.
No, no, you're good. You're good.
You did.
Oh yeah, right, cool. Okay, yeah, so if you look a little bit lower on that left side, and then you can see how at the bottom it says like medical education. So if you want to click that with the trigger, yeah. And then now keep continue. And then if you go back to that left side, yeah, so you can see how it says University of Saskatchewan?
Yes.
You can just actually click on that, I think, yeah. And then you can go to, if you scroll down, and then you can go on the left side, it says like chest X-ray. Oh, you can actually do some other stuff too if you want. VR teaching modules. Yeah, so you could like on the left side it says, oh, you can pick what you want. But I think the chest X-ray one is like, oh, that's cool.
Oh my
Yeah, you see that?
gosh.
Yeah, right? That's so cool.
This. And then once these guys are done, we'll
And then now it's
sit
gonna download. Oh yeah, so if you go to,
It was 1:30.
oh, they don't have anything in that
No,
department, I
that's
guess.
not right.
Yeah.
Can I feel your pulse?
To the chest X-rays? Yeah.
Those are
Oh yeah,
Can you-
I think if
can
at the bottom it
you
should say next
Put
or
up the
something.
timer for 15 seconds on your phone.
Like if you look down a little bit.
Oh.
Yeah, there you go, yeah.
It's Apple Watch.
Oh yeah, now you can like kind of pick. So I think those were like the normal X-rays. And then I went to like the second page where they had like a third one.
Sorry, I just like put my hands in.
No, it's okay.
15 seconds?
It doesn't feel like 133. Okay, give me a sec to find it pulse again.
This is the one
And
that.
go.
Yeah, that's the one I did, exactly. So you could like pick the bottom one, and then I think you have to go download. Yeah, and then if you go to downloaded cases at the top in the gray, right under the search button. So it says like, yeah, you can click there.
That's high.
I know, that's talking
And
about
then-
this. Or it is actually.
There you go. And now if you
31
use,
times 4, so,
so
it's not off.
basically unless you have a main trigger
Go
and then
see a
there's a
doctor.
secondary trigger that you
That's
have.
really high.
your ring
Because
finger.
if
So
you're
if
young
you
and otherwise
Go look
healthy,
over
like
the
not
picture and you
just
can
one
hold
Yeah,
with
yeah,
your
yeah.
ring finger, you can drag and drop it.
You should go see, like if that's always your muscle
And then drop it there,
that's
yeah.
a little bit abnormal,
That's
so
so
I
sick,
would go
right?
see your doctor about that.
Oh, that's
Sincerely a
Yeah.
doctor.
I mean the cancer's not cool, but like the picture's cool.
I mean, I've always had heart rate.
Does she have like something?
Yeah,
No
right.
heart beat is
Here, we can
better
ask.
than high.
Do you wanna
There's a
look back
range,
at like that
you
thing?
want it too low, because
Yes.
Yeah?
Is it like
closer
that?
you get to zeros.
Oh yeah, yeah, if you click that, you can
Yeah,
see
yeah,
it.
yeah.
That's
So
that.
like the lowest
So
I've
it's
seen where
pneumonia
it's
as
still
well.
healthy, like a
Left,
young
lower,
man
what is that,
runners,
lumbar?
they'll get 48,
No, that's
which is still quite low, and then like 48 to 90 is kind of what we'll see, and then if you have some heart conditions like
Oh,
atrial
that's so
fibrillation,
cool, and you
you'll
can
be
see it there?
to 130s.
That's so funny.
So then you don't like that with the drug medication. to
Yeah,
see
no,
that.
I'm seeing everything.
Do you
I'm
know
seeing
how
everything
heart rates
here.
feel like this?
That's so funny. That's cool.
Okay, just
Like,
like one day your
I-
Apple Watch set it.
There you
No,
go.
like,
That's
I
all.
You saw like the
Okay.
pacemaker, that was so cool.
Oh wait, okay, look at the pacemaker.
Oh, yeah.
Actually, 100 is not bad, but
So you can like see it.
165.
Ah,
Yeah.
yeah, there it
That's
is.
so
You guys
funny.
want to see a pacemaker? Look, there's a pacemaker in the machine. Isn't
So
that cool? Cool. So I'll get you guys to switch it up now, and you guys, one of you can kind of watch things unfold.
Yeah.
And then if we have enough time, I'll load up the paramedic suite, and you guys can
Yeah,
go
but
through
then.
it and then the rest can watch.
Sure.
All right, so you guys will go to that station. These guys will come over here. And sorry, you guys, I'm blanking on these names. Names.
Ish.
Tish, Ella,
Daniel.
Daniel,
Sargana.
Yeah.
Sargana.
Sargana. Okay, perfect. I'll keep asking you with the entire time, you guys.
give it a go first.
And then I think this is the right, no. Is this the right one?
You can bring both over.
Okay.
Oh, sorry, no, I mean, yeah.
Yeah.
Whoa, I see the stars.
Oh, yeah, sorry, so the other.
I don't know, literally, you see what I
Like
mean?
actually?
Yeah, I see Earth.
Yeah, this is the right-handed.
Oh, where am I? On the moon?
Okay.
Yeah, so as a radiologist, you have multiple options to set your setting. You could do it in the living room, in a
This is
beach,
cool.
but because we're nerdy, we did it on the moon base, so
Okay, you want me to check your heart rate?
you could actually change that. Yeah, so what you're gonna do is you're gonna find each other's pulses and find your own pulse, however you guys are comfy, and it'll be on the outside towards your thumb.
Yeah, just check it. How do I tighten this?
Maybe a little bit on your side. There you go, right about there is where it'll be. Find it here, boundy and pulsy.
Sorry,
And
if I pull your hair.
is that the thing?
And there's also a strap on top. Sorry, I'm just gonna,
Yeah, you're good.
one right there, yeah, and you can peel that off and then tighten that. There you go.
That made it easier. I mean,
I have one.
You feel yours? Okay, perfect. Found
I
yours?
think it's this one, so I just pull it.
Yeah, I
Do you want a hand?
That would be great.
Oh, I see.
So arms right there. You can use that pearl as guidance right in front of that.
Oh,
Yeah, perfect. Okay. So what one of you will do is you'll be the scanner. So one of you will put the headset on. Okay, so this one's different. This is mixed reality. You will have situational awareness. You can see me, and then you can put goo on your partner's radial pulse once you've located it, and then you can scan them. These are right and left-handed, so left hand, the other one's right hand. The trigger finger will do the bulk of the work. There is a little depth gauge in the lower left-hand corner, and you can use that to make things shallower because your radial artery is actually quite superficial. So why don't we scan Sargina first? Daniel, you can slip that on. That dial at the back, this one's a bit different.
We got the right one.
Yeah, righty tighty, lefty loosey.
Oh, actually, no, but. Oh, no. I can switch, yeah, I can switch.
Oh, that's cool.
And then just kind of goo on you. And then is the circle, is it blue or orange?
Blue at the top, green at the bottom, scan.
Okay, click on vascular.
Yep.
Click on scan. Now do you see a circle that's a
No.
snowflake?
A circle, yeah, see it.
What color is it?
It's blue.
Okay, perfect. So you're good to start scanning.
Cool.
What is your depth in the lower,
Yeah.
your left hand corner?
You
It's
see
like,
it.
oh, oh, wait. Oh, I can change it.
Yeah.
Yeah, so it's 2 centimeters right now.
So go to like a centimeter and a
I'll
half.
try.
You just drag and drop,
Yeah.
yeah? And then you can start scanning.
Okay,
So you're
good.
probably
Oh, there you go,
done
yeah.
with the hand controller for now.
Okay.
You can hold on to it if you
What
want,
did
but if you just
do?
want
Oh,
to
I
use
can
this.
switch.
Or I think you can like rotate it, no?
Okay. And then I'm just going for it?
Yep.
Okay, do I need to like submit?
No, your probe will do that for you.
Oh, there you go.
Oh. Cool.
And I'm looking for,
A tiny little pulsy thing.
Yo.
You're probably going a little bit too high. Come up forward just like a half centimeter.
like towards you.
Yeah, this
Does this
way.
person like swallow headphones?
Oh, my headphones? What are you looking
Are you?
One second, they've intrigued me.
at? No.
Or the.
Oh, is that pretty?
You changed the contrast a little bit too much.
Oops,
What
sorry.
do you want to see on the?
So yeah, there's like.
Oh.
behind?
Oh, no, sorry, you've changed, you've inverted it, so you know when you see the negative of the film, that's the view you have right now, so that's why everything's a bit wonky.
Like, yeah, it's
So if you look
extreme.
down again, you
Right,
should
or
be,
reset.
yeah, or just go to reset, you can do that.
Hmm.
Or even just, yeah, there you go. Okay, so can you use your tracker to show us the headphones you're seeing?
Oh, I see it. Oh, wait, is that?
Yeah, these are headphones.
Yeah, I see it.
That's the heart.
so cool.
that-
No, these
Yeah.
lines.
Oh, that's so sick.
We see your cursor, but we.
Yeah, so I can see like your.
In my estimation as a medical doctor, that's
I
the
can
heart.
see like your, like, it like this.
I would just.
Like, do you understand like?
Oh wait.
Wait,
like,
we see what you're seeing.
Heart rate, is it like one?
No, seriously, it was like headphones. I don't know if they're inside or they just outside.
Yeah, that's
feel
it.
right.
Yeah, that feels right.
Do Oh, yeah, okay, you have better resolution. No, you are seeing the pacemaker wires. Those are the leads.
Oh.
So on the outside, you got a
This
pacemaker
guy's all
cursor.
like-
This
Yeah, yeah, yeah.
Pacemaker?
So that's the pacemaker
That's so
implanted
cool.
under
Wait,
the
so, like,
skin,
you would
and then
have,
the
like,
wires
track-
are the leads to where they
Oh,
need
yeah,
to
I
go
can
in the
still
heart.
like
So
that.
yes,
Oh.
you were tracing out the heart, but those are like where they need to be in the atrial ventricles. Yeah, and
I
so
see.
then here's
Oh, I
the
lost it.
here's the lateral, the
Where did
sideways
you-
view. So if you're looking at them from the shoulder on, okay. And then if you're looking over here, you can see like head on, this is what the pacemaker looks like, and then you can see those leads going down into the various parts.
And they're inside, actually, like they
Yeah,
connect?
yeah.
That's cool.
Yeah, and so then you can
Oh,
kind
I
of,
love your-
like, if you want to get
Find
a
this
quick
one.
orientation to what you're looking at,
It's
so
like
this
a
is
little iron.
like the collarbone, the clavicles, the humerus, you kind
Oh, I
of,
see.
you will always have the same methodology towards looking at,
How large
at
is
a
it?
chest x-ray, so some people go from
It's
outside
such a
in,
small
some people
spot.
do bones. So
Like
here
a
you're kind of
few
looking
really
at soft tissues,
Yeah,
here are the
it's like, you have
bones.
to be so.
You want to make sure the rotation isn't over-rotated because that
Are
can
you
affect
saying
how you
just
see
like
things.
the
I'm
entire
just-
area of
Let's see
skin
if we can
that's
change.
like,
Okay, what?
I think
That's
so,
the
yeah.
thing.
Yeah, I think, yeah, you're right. That's what I'm saying.
Here.
It's just like,
That's not
like one,
working.
it's just literally just a
Image
tiny spot.
manipulation.
That's like moving by itself. It's a sea of gray. I'm kind of confused about like the orientation. What am I looking at? Like, is this like a top-down view or?
if you like look down, is it?
Oh, if I do that, no.
Yeah,
It's just because it's just like it's like a fixed. Like imagine like I had like another screen just in front of me, and I can see you still as well. So
Okay.
yeah,
There we go.
but I can see it now. I do have.
Manual, okay, there we go. So now I can change the shadowing
This is the
of
left.
this, making it way brighter,
So I
making
can
it
just control
darker.
everything at once.
And so that kind of makes me look for, lets me look for nuances. So the other thing I want to see is like how
Yeah,
the
so
lungs
see,
look,
yeah.
if there's like, there, I don't see like a nice sharp trace here, so I wonder if there's a little bit of fluid here. Okay, and then the other thing is I wonder, this must be an elderly patient, I'm saying that because they have
Oh,
a
I see.
pacemaker, I don't know that for sure.
That's what I thought, but
Also,
no, never mind.
Their
It's just
lungs
this
are
size of the
way
screen.
long, so we call it hyperinflation, so
But I
that
see it though, I see
suggests
your
that they've been a
But then how
lifelong
about-
smoker or had
Slow,
exposure
slow,
to
fast,
secondhand
slow,
smoke.
I see.
So then you're also seeing ribs, okay, so these are the
Oh my-
posterior
oh
ribs
my
and they're
goodness.
coming out front,
Mhm.
okay?
Can
So,
you tell how
1,
like
2,
deep
3,
down?
4,
Can you
5,
see like layers of skin
7,
and
8,
That's what I'm thinking. I think I can. But I'm not seeing
9,
any
10,
issue.
I think I missed
It's kind
count.
of hard to.
But you can see those are the rib shadows equal on
To be
both
honest,
sides,
right.
okay? You're seeing normal along the markings, so you want to see that they go all the way towards the edge. If they don't, you want to look for black
Oh,
shadow,
yeah, I
that's
see.
this
It's
there's a
easy.
collapsed lung,
Maybe
which
I know
is
that
bad.
wrong.
If you see a lot of cloudiness, then you wonder about a pneumonia, okay? And then you can also see that this is a female patient because you can see the breast
Oh yeah, now I just
shadows
stopped because
here.
like now I have like okay,
Yeah.
that's so cool.
And so sometimes like if they're
Oh,
wearing a
I see.
necklace or buttons, you can see that as
It's just
well.
like oh yeah, I don't know, it's not showing me anything. It's just like a layer.
Here you can see the
Like a uniform layer.
spine,
That's cool.
okay, and if I were to play around with the windowing,
Here, I think.
you might be able to
Oh,
see
yeah,
the
you wanna-
spine a little bit better,
It's so funny.
okay? There we go, so make it really dark to kind of make that contrast apparent. You can see the lung bronchus,
Sorry.
and then you can kind of see
Oh yeah,
it
you got
separate
it. I
into the
believe
two
you. Here,
lungs.
I'll tell you.
Okay. And then on this lateral image, you can see that spine better.
So
So
you like pull it a
here's
little
the
bit and then.
thoracic spine and the lateral, sorry, the lumbar spine.
Is it?
Yeah, so it pulls a little bit.
So there you go.
Yeah, a little bit.
Little
You can like
bit
kind of
of
go a lot in.
Yeah.
And then there's a dial at the
Bless
back.
you.
And you can like make it right. You can see right there.
So do you guys want to move on to the, what time is it?
Actually, I want to look at the
Okay,
music.
thank you.
Or like
You
the
can see that, right? Yeah, so yeah, you can like
Well,
do
actually,
whatever you
no,
want.
we didn't
I
try.
think
That's okay.
so I didn't find any curves.
You found
Yeah,
it?
it was like a tiny module that was like
Yeah.
moving, right? That was quite cool, yeah.
And then did you go to the 90-degree transverse view? So if you do
Oh, no.
that, you
And
can
right
see it follows along
Yes.
to the tube. So if you're trying to put it in an arterial line,
That's
that
so
kind of
cool.
lets you know, is it more off to this side, off to this side, and then you
That's
can put
so
in a needle.
Okay,
So then it helps you, so when we, like back in my day, you would just do this procedure blind and you would put an arterial line in it, but now the standard of care is just to visualize because there's an anatomical variance.
Cool.
So, you know, maybe someone has a teeny tiny vessel that's gonna be really hard to pull, really easy to miss, you wanna visualize it, so then you can see
Or you
kind
can
of,
look
oh,
at
it
the-
veers off to
the
this
earth.
way, I'm gonna change
Oh,
my
Yeah,
mind,
that's
you know,
true. Yeah,
so.
keep the
That's so cool.
turning.
Yeah.
That's so
Yeah,
cool.
there.
Listen,
Wow.
let me go.
Look at that Africa. Oh, you're being too delicate.
Oh,
I'm
okay.
trying,
There you go.
I wanna look at other foods.
I think shoe party though.
I don't wanna look at the one anymore.
So go at the bottom, and you see agreement, click on brain, maybe, and then just,
Activate the tool.
I think if you click on it and then click on the screen, it will like replace it.
It says activate the tool.
Oh, okay, yeah.
She wants to look at other things.
Oh, or is it just one? That's okay too.
Is it,
So,
what did it look like?
So then if you want to look at other
I'm
things,
not gonna do this
so
now,
then
but you have to kind of
go
look for like a
look to your
pulsating
left,
kind
go
of
back to
pulse.
medical education, okay? And then go down. So here you can tell, so actually go look at this report for a second. You can see new areas of submental classification in the medial left lower lobe. Interesting. They're seeing a pneumonia. Can you
Maybe
go
like
look at that?
Press a little more firmly into my
Look
arm.
over. That's interesting. I would
Oh,
call that
I
a
see it.
pneumonia.
Yeah?
With that
Oh,
clouded
that's-
shadow
Yeah,
on
right?
the bottom of that
And then
left
when she's breathing, you can kind of ask her about like the whole like.
lung there, because
Or
like
you
you
can
can
try to, yeah, you can go, yeah,
Can
you
you
have
look
the
at the
one.
sideways lateral?
You can try to,
Yeah.
see if you can like,
I think they're seeing it
Wait, do
more
you see it
there,
so?
that cloudiness in the left lobe.
or do you?
Okay, so if you
Sorry,
wanna
this is-
go back to
No,
the
you're good,
left
you're good.
view,
Cause that happened to
go
me
down to
sometimes.
medical
I was like, let me try to-
education, click on that, okay, and then, look, oh, I see.
You see it? Okay, and then I think there's something about like a, like
Yeah, click on
a
lower
horizontal, or like a
browser.
perpendicular view or something like that.
Oh, okay,
Yeah.
and then,
At the bottom.
Is it
go
like
to
this
correct
one?
directory.
Go home.
I think
Click on
once
home.
you.
Oh yeah, go up, yeah, sorry, go to home, try one more time.
You can see it, right? It's like a bulb that's kind of like just.
Yeah, I think I
Go
like.
up one level.
What is it?
Oh yeah, you
I
can.
think I
Oh.
like a photo.
Oh, yeah.
That's really weird.
I was thinking.
Okay,
Whose brewery is this? Who's this supposed
go
to
to
be?
the, what's the red button say? That one? Yeah. Clear all studies. Okay, perfect. Clear all studies. There you go. Oh,
Oh, that.
okay. Try
Wait,
clicking on
you
medical
good?
education one more
There you
time.
go. Fun?
There you go.
Oh,
Okay,
on
click
this.
continue. Okay, and then go to this.
Yeah.
Yeah, click the MR. Click this again.
Yeah, I think I'm in like the right
And then
spot.
let's see.
Okay, there it is.
That on it?
Go to CT call. So the CTs take longer to download, which is kind of why I don't usually go to them, but,
Next.
oh, no, it'll just take a second to load, and then CT call, what do we see? Try that, clicking that for that bubble in the first one, the A14B case, click that, click download. Okay, and then it'll go to downloaded cases, click that, and it'll tell you
It's
how to
so
download
crazy
it.
to, like,
See
So
it,
it'll
right?
take a
Yeah.
minute because
It's
it's.
like, oh, great, you're fine.
Yeah.
And then you got like these giant
Once it's
bubbles.
done, you'll use the bottom trigger to drag and drop it, and then you'll be able
Actually,
to go through that.
We're not
And
actually.
I think this is a brain CT. So, yeah, I usually stay away from them for demo purposes
The
because they take so long to download.
I'm
Yeah.
trying to wait, 'cause you already found me, then can you just like do it through you, right?
That's
Yeah.
So she found my,
Is it every-
she found my pulse.
my.
Oh, you lost it? No, you're good, you're good. You're good. There you go, I think that was this one.
Any constellations?
And then press it a little bit further.
I don't know if it has constants.
Oh, oh,
Found it?
I like how it's divided into triangles. That's interesting.
Because we're in like in the dome, you know?
Oh, weird.
Yeah, like in like the Martian, you know?
I see.
Have you ever seen that movie?
I have, but maybe.
Okay.
Got it?
Yeah.
cool.
Got it. So, and then the other thing, yeah, so you can adjust your depth.
You're on
If you
move.
play around with the gain, it makes it brighter versus darker.
About the same.
And then if you want to visualize the length of it, you can just rotate 90 degrees and see what that tube is doing.
So how would I rotate?
Oh, you would physically rotate
Oh,
it. Yeah.
Oh. Oh, I see.
Yeah, so you're going from one cross-sectional view to the lengthwise view.
Just
You
drag
can see
it
like
down.
this little pulsating snake like thing.
So everything you see is like a bird's eye perspective.
Oh. It cross-section, so it's like, it's putting out a high frequency
Oh, there you
beam
go.
that's kind of
Click
just
on the
putting a
images
section
on
through
there.
versus a section through, so
Yeah.
that's what you're seeing. And if you see that black shadow underneath, that's its radius as
Or just driving. Oh, there you go.
Yeah. Yeah, so all of your tissues have different echogeneities, and so air has like is not very good for transmitting things, so it's very you run into problems right away. Or if you're trying to scan the abdomen, you have a bowel full of gas and makes things just full of interference patterns. But like what's really cool is the different tissues can actually give you windows to look at. So if you're scanning through the liver, it makes an acoustic window, an ultrasound window through which you can see the rest of the lungs or even or so the rest of the abdomen or even the heart. So.
Oh.
Yeah, so ultrasound is really cool. Like it's very helpful. I can use it to look for detached retinas. I can use it to look for trauma and internal bleeding. I can use it to look at what the heart's doing.
I think so.
Because this looks like the jaw.
Oh yeah.
This looks like I can look at blood clots from lungs. Or even to do an procedure. Yeah.
Low.
No, like the jaw, like the connecting part.
I don't know.
Did you guys get into the CT?
Yeah.
Oh, you found the CT head.
Yes.
That's awesome. Okay, look at that. So are you able to scroll through the image? Because you should be able to, like you're just looking at the jaw and the bottom of the cerebellum now. And those two holes are the airway. Oh, yeah, you're scrolling up. So this patient has a lot of dental work, so all of those rays you're seeing is just artifact from the metal hitting. So now you're going up through the mandible.
This is the axis and the atlas.
You got it. Look at that.
Oh, that's so cool.
Yeah, so now you're going through the spine. There's a hyoid bone, so you've gone down.
Oh, am I going down?
You're going down, yep. So you're going through the spine. So now you're going, so now you're going to the cerebellum, right there.
I can't go up
Oh. That's a bit odd.
So it's just the cerebellum.
That's not a very good brain scan.
You can probably reset if you can.
And then I'm going all the way.
Which pack did you guys download?
They went to a
CT.
CT scan.
CT scan?
Yeah, so I don't know.
That's so funny, I can see it through here, yeah.
Yeah, the screens don't come through as well on when you're looking
Yeah,
through
I
mixed
can-
reality. But you can see this is CT
That's
scan
so
of
cool.
and the brain, neck and spine and
That's so funny.
yeah.
Can you go
And-
through the layers too?
Yeah.
Awesome.
Oh wow, look at
Oh
that.
yeah, there you go. Oh, that's it.
There's the cerebellum.
Yeah, there's cerebellum, there's the jaw, there's airway, there's the mandible.
So sick.
Can you go to the coronal with the full-on view to your, there you go. Oh, that's a sagittal. Okay, so scroll through that, see what happens. Yeah, so there's the mastoid, not that, the other thing behind it. So there's the jaw, there's the maxillary sinuses, that airspace, that black. Yeah, there's the spine.
Oh yeah, that's so funny.
Are these black spots in the sinuses?
Some of those are air, so this is like that one that you're on right now is just the airway.
Oh, okay, I see.
Okay, and
Yeah,
so,
I just grabbed the.
oh, yeah, sorry.
No, you're good, you're good. That's so cool.
There like a certain angle that's.
Over there.
Yeah, so you want to kind of be fully perpendicular, so you want to be full on, like 90 degrees.
That's
Just grab the book.
Yeah, sorry, took over.
No worries. Oh, so now it's
There's a
hard.
space here that
Oh, you guys, it's 3:20, I'm so sorry.
Oh my god, is this?
We're good.
Yeah, we
Here, let's
went
do speed.
that
We're
far.
having too much fun.
Is this the ear part here?
Yeah, so that's the mastoid bone, so that bony part right behind your
It's like
earlobe,
over
those
here.
are the mastoid cells. So sometimes in cases of really bad ear infections, you can get an abscess there, and then like 1 in a million, like really rarely, those abscesses can travel into your brain.
I think it's.
So,
Wow.
but, or you can get infection of that bone, which we call mastoiditis, which also requires lots of IV antibiotics.
I could do this for hours.
That's awesome.
It's cool stuff.
This is great. Usually the casting doesn't
Oh, I
work.
see
out.
the bone.
So glad it worked out this time.
Yeah.
So you guys are welcome to stick around if you have nowhere to be. However, I feel like it's my duty to tell you that it's over.
Yeah, I think this is the best session we've had, and, you know, a lot of things that cause that, but having the right number of people.
Yeah, it worked out having, because in the bigger classes, when you're kind of rotating, people get done stations more quickly. So,
Yeah.
Thank you so much.
yeah, you guys seem to have fun with that.
Yeah.
That was awesome.
This is the one time I actually have to do something at 2:30.
No worries. I'll write you a doctor's note.
That's so cool.
Yeah.
Yeah.
Yeah, do you need help?
No, it should be okay. Thank you for offering. I'll just clean everything up and then make sure everything's off. And then, thanks for offering.
Yeah.